Hi, I'm Kate Harrison. I'm a Board Certified Behavior Analyst with Brett DiNovi Associates. Generalization. I find myself talking about this topic a lot because not only is this an important topic that the BCBA expects behavior analysts to be competent in, from J11 on the 4th edition task list, but it's an incredibly critical component in providing quality ABA services that is far too often overlooked or assumed. If a skill is not generalized to the natural environment under non-therapeutic conditions, then it's not truly mastered. As one of the 7 dimensions of applied behavior analysis, Baer, Wolf, and Risley describes generality of behavior change as durable over time if it appears in a wide variety of environments or spreads to a wide variety of related behaviors. Stokes and Baer identified 3 facets of generalized behavior change as across time, across settings, and across behaviors. Generalization can and should be planned and trained for during direct one-on-one sessions with RBTs, but at the end of the day, the RBTs go home and the child's remaining time is left in the parents' tired hands. They can provide their children with additional practice opportunities and do so across new people, stimuli, and environments in a way that cannot be matched by RBTs. It is for this reason that parent involvement in promoting generalization and maintenance of skills is so important. For decades, studies have shown that while parents of course want to see their children improve, their children's improvements alone do not appear to be enough to reinforce treatment efforts outside the therapy setting. And honestly, that makes sense. Imagine how tough it is to work a full-time job, raise a family, pay the bills, manage appointments, school, and extracurricular activities, all in addition to having a child with special needs and having to arrange for those services as well. It makes me exhausted just to think about it. All of this is true, and a parent's involvement in carrying out therapy instructions is still critical to the generalization of skills and overall improvement and quality of life potential for our clients. As outlined by St. Peter et al. In 2014, non- or reduced adherence has the potential to lessen the outcomes of ABA interventions in the same way that it does for both medical and mental health interventions. Understanding the rationale for parent involvement and figuring out how to increase treatment adherence is part of our role as behavior analysts. In 1977, Bates recommended monetary contingencies among several other strategies for parent completion of assignments, and throughout the 1970s, there were several studies that implemented and replicated interventions that successfully used money in various ways to reinforce parent cooperation. In 1982, Muir and Milan used the lottery system to maximize parent training effects by rewarding improvements in children's behavior rather than for time and effort devoted to the programming. Because although devoting time and effort to programming, these alone unfortunately will not necessarily result in behavior change. Using an AB-AB reversal design, data was collected for baseline after the parents were asked to provide instruction for 3 objectives across the week. A mastered task was included among the 3 objectives to ensure that the parents could contact the reinforcement contingencies early on. When the lottery condition was introduced, it was explained to the parents that for every objective that the child met criterion on, the parent could earn a lottery ticket. The lottery tickets would be traded in for things that included donated toys, household merchandise, and restaurant gift cards, all with a value between $5 and $10. Because lottery is random, there's a possibility that eligible parents may not have been reinforced for their efforts. So, to control for this, an actual drawing was not used, and instead prizes were delivered on a pre-planned attenuating schedule of reinforcement. Results of this study showed a dramatic improvement made by the children during the lottery condition, which is especially impressive because each of the child included in this study had a history of minimal progress. Not only did the children make drastic gains during the lottery condition, but their parents also displayed untaught creativity in how they incorporated teaching targets into their child's day. For example, one parent incorporated a skill during Simon Says and another used a sibling to practice a skill. When the lottery condition was removed, all 3 children returned to baseline rates, adding to the hypothesis that child progress alone may not be reinforcing enough to control the parent behavior. While it may seem to some that this approach aims to bribe or pay parents for things that they should already be doing, our role as behavior analysts is to look at the contingencies at play and that are impacting our clients to determine how to best help them and maximize their potential. In this case, that may mean adding supplemental reinforcement to our parent training programs. As noted by the authors, this procedure is flexible. It could be implemented with parents or paraprofessionals to increase learner progress, and the lottery prizes could be tailored to the individuals. While the financial component is definitely a consideration, a lottery system may prove to be a valuable investment to maximize children's progress. Would you or your agency consider a lottery system to increase parent training effects? Why or why not? What are some of your own favorite parent training strategies? We want to hear from you. Leave a comment below, and if you want to help us spread the science, share this video with your colleagues and subscribe. Thanks for watching.